Okay, diaper addiction. Gotta admit, when we saw this one come across, we weren't really sure what to make of it, but
No.
that's kind of the beauty of these deep dives, right? You never know what you're gonna get. So, we're tackling diaper addiction. Now, disclaimer, not exactly overflowing with research on this one,
Right.
but hey, sometimes the most unexpected topics get those wheels turning.
Absolutely. And I think it's really important to, approach this whole thing with sensitivity, right? Incontinence, it's a personal thing. It can be...
Yeah, sure, yeah. Not exactly a conversation starter at a dinner party.
Exactly.
So our source material, it just kind of throws it out there. Diaper addiction is possible. Even goes so far as to say, if you're struggling, reach out. Diapers aren't a replacement for medical advice.
Right.
Which, okay, that kind of piques your curiosity, doesn't it?
It does. And honestly, it might point to a bigger issue here. Maybe some misunderstanding, maybe even just like a reluctance to, even talk about these things.
Okay, so if we're saying this diaper addiction, it's not an official diagnosis, then what are we even talking about here?
So there are a couple of ways to unpack this. First one, let's say someone, even without a medical reason, feels this need, this dependence on wearing diapers.
Okay.
It could be anxiety, right? The thought of having an accident, even if it's never happened, it's just like this overwhelming fear.
So they're using diapers as a kind of like a security blanket almost.
Yeah, exactly. It's about managing those anxieties, feeling, sense of control. But of course, there's a line, right? When that comfort becomes, when it starts to hold you back.
That's where reaching out to a professional comes in.
Absolutely. A doctor, a therapist, they can help figure out what's really going on. Is there an actual medical condition? Are we talking generalized anxiety, trauma, OCD?
Yes, it's not always just a physical thing. There could be a lot more to it.
Exactly. Now, the other side of this diaper addiction thing, it might actually be masking a real medical issue.
How so?
Well, someone might be using diapers, managing as best they can, but they haven't actually addressed the root cause, the incontinence itself.
Because of embarrassment. Or maybe they don't even realize it could be treated.
Could be. We see it all the time, unfortunately. There's this stigma, this fear around incontinence issues. But the thing is, so many of these conditions, totally treatable, but you got to be willing to talk about it.
Which can be tough. So bottom line, for someone listening right now, maybe thinking, this is different, but maybe it hits home, what do they do?
First and foremost, you are not alone. Seriously. And asking for help, that's not weakness, that's strength. Talk to your doctor. They'll figure out what's going on. They can recommend treatment, therapy, whatever's needed. There are also great organizations out there, National Association for Continence, the NAFC, tons of resources, tons of support.
It's like anything else in life that throws you a curveball, right? Whether it's your physical health, mental health, feeling overwhelmed, talking to someone, it helps. No shame in that.
Couldn't agree more.
This has been, a pretty enlightening look at something we don't usually talk about, and it really makes you wonder, what other conversations are we avoiding? So if any of this resonated, remember, you're not alone, there's help out there, and you don't have to go through this alone.